A new CDC study says prevention measures are still key to controlling COVID-19, even with increasing vaccinations. Public health experts worry people may stop physical distancing and wearing masks too quickly, and that could undermine gains made by vaccinations. Alabama's statewide mask mandate lasted 266 days. So what impacts have masks had on our mouths and overall health? We sent Way 31's Luke Hydash to find out.
Is it possible that wearing one of these could lead to cavities? One Decatur dentist says not exactly, but oral health as a whole may be slipping during the pandemic.
People are at home more, watching more TV, playing more video games, things like that.
While you're doing that,
when you're bored, you tend to snack.
Dr. Josh Drake from Drake and Wallace Dentistry in Decatur says these snacks are usually sweet or high in carbs. That can cause cavities. And with the pandemic, people aren't necessarily chomping at the bit to return to the dentist.
Just now starting to make their way in here, 12, 18 months, 24 months later. That tends to lead to maybe a few more problems.
But what about the masks themselves? Colgate releasing this article saying wearing masks for an extended period of time could lead to mask mouth, what is basically dry mouth. But could that lead to tooth decay? Dr. Drake says it's possible, but unlikely.
Masks themselves, I don't really think is going to be the factor here, other than maybe making people tend to breathe through their mouth more than they normally would.
Dr. Drake says he hasn't seen a noticeable uptick in cavities, and he doesn't see a direct connection between face masks and bad oral health.
The drier your mouth is, the less saliva you have, the less natural protection you have from the bacteria. And so the drier your mouth, the more prone you would be to problems.
Dr. Drake encourages people to get a cleaning, especially if you haven't been to the dentist since the pandemic began. In Decatur, Luke Hydash, Way 31 News.